My name is Dr. Naina Harawa. I'm here today to talk about the challenges, risks, and opportunities associated with HIV and incarceration in our society. I'd like to start with a shocking statistic. 17%, it is estimated, of all people living with HIV or AIDS in the United States are estimated to experience being incarcerated at some point in any given year. This means that if you're providing services to clients who are living with HIV, between 1 in 6 and 1 in 5 of those clients are either currently in prison, jail, or juvenile detention, or will be at some point in this year. Today, I'm going to focus on how can we best address the healthcare needs of those individuals as they leave custody and reenter society. It's also important to realize that there are elevated levels of HIV infection among people who are incarcerated. The Bureau of Justice Statistics estimates that levels of HIV among people who are incarcerated are 2 to 3 times that which is observed in the general society. The reasons for this are multifold. Yes, some people do acquire HIV while they're in custody because of risk behaviors during custody. But it seems that most people who are HIV positive and incarcerated were HIV infected prior to entering jail or prison. I'm just going to show this next slide briefly, but really to point out that this issue of incarceration in our society is one that's grown tremendously over the last 30 to 40 years. Largely because of the war on drugs, our incarceration rate has increased to about 2.2 million people. Currently, there are 2.2 million people who are either in jail or prison. And there's many more people who are under parole or probation supervision. So we have about 6 million people in the U.S. who are currently under some type of surveillance by the criminal justice system. So I think of both HIV and incarceration as epidemics in my research and in my work. Now, while people are in custody, HIV medical treatment and care is one of the services to which they are considered to have a constitutional right. And while there's aspects of that medical care, and those of us in California unfortunately know this well, that sometimes the medical care people receive in prison might be suboptimal, we know that as a whole, people in prison who are living with HIV actually do better during those periods when they're in custody than in those periods following it. Now, the reasons for this are multifold. Even though there may be aspects of care in prison that are suboptimal or treatment interruptions that occur while people are in jail, as a whole, they have a less daunting process for entering into care. There's not huge numbers of forms to fill out or waiting periods or intrusive questions to get that medical care to which they're entitled. 2, the process of being engaged in one's care is relatively easy. There's not transportation issues to get to the prison medical clinic. Pill call or medication generally comes directly to the dorms or is provided in some other systematic way so that treatment adherence and attending one's medical appointments are relatively easy. And 3, the other basic needs of prisoners are already being met, at least the needs for shelter and for nourishment. And so they do not have to spend time and energy or resources trying to acquire those needs. Of course, when somebody leaves custody, all of that changes. Now the energy, time, and resources that they spend getting shelter, getting nourishment, or perhaps indulging in other priorities and other needs when they leave custody might take away from the time, energy, and resources it takes to be a good HIV patient. 2, there's no real universal healthcare system for people to link to on release. So even though in California and in most of the US we're lucky in that people are able to get care even if they can't afford it or don't have insurance, that system, there's not one system in which people can enter into easily. The process of getting into that system may be challenging. At the same time, prisoners may be trying to reestablish many other types of benefits that they lost or other things that they once had, such as an apartment, a car, employment. And so their time and energy is divided and they have additional distractions to deal with. Because of all these reasons, we tend to see very low rates of linkage and retention in HIV medical care among formerly incarcerated individuals. I'm particularly aware of one statistic from Texas, which showed that in their research with former prisoners, only 30% had been linked to medical care within 90 days of release. So how can we improve on these statistics? There are a number of models and programs which have been shown to be effective, and these successful efforts tend to have a number of elements. One, it's ideal if you can start the process of linking people into care and making a plan for their successful reentry into care or first entry into care prior to their release. So it's very crucial that people work with HIV-positive prisoners while they're still in prison or still in jail, if at all possible. Two, wraparound services are often a key element, and I'm going to talk more about that. Three, a medical home model, such as the Transitions Clinic here in the Bay Area, has been shown to be effective for dealing with HIV and other medical conditions, particularly if it's targeted towards formerly incarcerated individuals because of their unique experiences. That's often been a care setting in which individuals seem to feel particularly comfortable. As I said, wraparound services are key to helping HIV-positive former prisoners successfully enter into or re-enter into medical care and remain in care. Key among these are drug treatment services and mental health services. As I said, substance abuse is one of the risk factors that puts people at higher risk, both for incarceration and for HIV. And drug treatment has been shown to help people better adhere to their HIV medical care and to be less likely to transmit their HIV infection to others, or at least more likely to engage in preventive behaviors. And so where possible and where clients are willing, making sure that they have access to either drug treatment services, drug-related treatment services such as AA or NA, sober living support, those types of settings is really key. And for individuals who maybe aren't ready to make that leap or to go to sobriety, it's still key that we recognize the role of the substances in their lives and work with them to achieve their goals in terms of their HIV medical care where possible. As I said, mental health is another one of those key wraparound needs that's needed for individuals who are formerly incarcerated. The Bureau of Justice Statistics estimates that between 40 and 60% of jail, state, and prison inmates have symptoms of mental illness, with depressive disorder and bipolar disorders being the most common. In addition to that, many formerly incarcerated people are facing these challenges without the social supports that many of us have or might need to help us meet such challenges in society. Their history, perhaps, of antisocial activities, the long periods of separation caused by incarceration from their loved ones and significant others may have cut them off from their traditional resources for support. One of the things providers may be able to do is to help those post-incarcerated individuals, where possible, reestablish some of those supports or manage some of the challenges that may come with those social relationships. But also, in some cases, those providers themselves end up being part of the social support system for HIV-positive individuals. Finally, housing, employment, access to food, sometimes to clothing, are also reentry services that may be crucial for HIV-positive former prisoners. In some of my research, people who've been incarcerated talk about the process of returning to society and experiencing that they had lost everything: their car, their employment, their home, the things that were in their home. And so these basic services are really important and obviously are going to be a day-to-day priority for many of the people who are leaving incarceration. So I would like to conclude by saying that incarceration and HIV as epidemics present us with some unique challenges. There's the institutional barriers, and in some ways, the social and political issues that people view in terms of providing these types of supports to people who have been convicted of crimes. There's the risk that people who are incarcerated experience both while they're incarcerated and in the period right after incarceration, and those risks may be both to their physical and mental health. But all of these also present opportunities. While people are in custody, they are literally and figuratively a captive audience that can be reached for starting interventions that hopefully will later lead to linkage and retention in care that is long-lasting and successful. And we can think of our work as creating a bridge between the inside and the outside for those who are leaving custody and even those who cycle in and out of custody frequently. And as individuals and agencies, we can work to reinforce that bridge with culturally sensitive and comprehensive services and other activities that support the needs of people as they re-enter into HIV medical care. It's important as we go through that process that we recognize that post-incarcerated people often face multiple layers of stigma. Some of the individuals at our focus groups talk about experiencing stigma. Many talk about experiencing stigma because of being incarcerated, but then they also talk about stigma related to their HIV status, their race, ethnicity, their sexual orientation. And so that even though stigma is something that people living with HIV and AIDS probably all face to some extent at some point in our lives, it seems to be something that's more intense and perhaps more layered for many of the post-incarcerated people that people may encounter as providers. So it's crucial that the care teams are sensitive to those issues and recognize them, again, as opportunities to help fill in the support and services that are needed for people leaving incarceration. Thank you.